International Affairs has called on all members of the community to report any illegal initiation schools to the police. This follows the death of 25 boys in the Eastern Cape. We're now joined in our Durban studios by the Deputy Minister of Traditional Affairs, Obed Bapela. But before we have a chat to the Deputy Minister who's there waiting for us, let's take a look at this insert.
In Xhosa culture, adolescent boys undergo an initiation that involves seclusion, ritual food, education, and circumcision. It is a learning and bonding experience and a portal into manhood. The majority of circumcisions worldwide are performed for religious or traditional reasons. Such procedures generally take place outside of formal medical settings and are performed by providers who may have special training. In African countries, the age at which circumcision is carried out varies considerably among ethnic groups and families and is dependent on religious affiliations and in some cases on personal preference. Although today circumcision is performed for most part by physicians, it is embedded in a wide range of cultural contexts and is quite different in mode, rationale, significance, and effects. In many traditional circumcision ceremonies, boys and men are educated about their responsibilities and duties as an adult member of the community. The actual cutting of the foreskin, while a pivotal moment in the circumcision ceremony, is a small component of the entire process.
All right, let's now talk to our Deputy Minister of Traditional Affairs, Obed Bapela. Deputy Minister, thank you very much for being with us on the program to talk about this very, very important issue.
Thank you very much, Leanne.
What are some of the causes of these recent deaths that have been reported?
Well, there are quite a number of causes that we have just been observing. We started from 2012 with 419 children dying, and last year the number was 116. And this year we then brought in measures to see if we cannot bring the death to zero levels. Yeah. And unfortunately, we are now recording 31 as we speak now. Yeah. And it's 31, 24 in the Eastern Cape, 5 in Mpumalanga, 1 in Limpopo, and 1 in the Western Cape. The many of the deaths are caused by bleeding as a result of the circumcision itself, and gangrenous wounds that are also or losing of the skin. And then that's one part. But secondly, we also had found that the pre-screening is never done. And then when children enter the initiation school, you find that they are diabetic already, or they have got other illnesses, or they are HIV positive. And then they go through the process. And then as a result, because of the low CD count, and we find that then it also leads them to death. So that is why new measures are now being introduced, like pre-screening as a compulsory now. And we are talking to traditional leaders that ought to happen, working with the health professional people that can come in and assist them. Yeah.
Tell us a little bit more about those boys that were rescued from the illegal initiation school in the Eastern Cape, because the Eastern Cape, obviously, even by what you're telling us about the death toll, where you're saying 25, I think you mentioned it was 24 boys in the Eastern Cape.
24.
24 have lost their lives. What happened there? What's their current condition?
Well, they were rescued from the illegal schools, and those who were worse conditions were taken to hospitals for treatment. And then immediately after the treatment is been done, then they are taken to a legal initiation school where the initiation part then is completed. And then therefore they are kept away from the rest so that treatment people can be on site. And we have enlisted the services of the health department, the social development department, who will then take care of those particular environments. So the illegal schools will then be banned by the police, because now we are working in partnership with the police, as is the case. And quite a number of illegal schools were discovered, burned down, and then the children were rescued. almost 200 children were rescued from the illegal schools.
Wow.
If we did not do so, the number of the deaths could have been worse than what we witnessed last year or even a year before.
Yeah.
And I think this partnership is now beginning to produce results, hence the death toll is just standing at 31. They are almost completing, because this coming weekend, all of them will be returning home. Leanne, the figure that we're speaking of, the children who go through the winter season, it varies between 200,000 to 300,000 nationwide. And therefore, it's quite a sizable number of the children that go through this initiation school. That is why, that is why we say we need then to begin to legalize them proper by bringing in a national legislation that will then force everyone to register a school. And secondly, to see if we cannot also begin to bring in health practitioners who will work together with the traditional nurses and the traditional surgeons and the traditional leadership itself without compromising or assimilating a tradition that has been practiced by Africans for all these years. But obviously modernization of the circumcision is something that we ought to look at, particularly the male medical circumcision, which is now something that they need to look at and consider.
Yeah, most definitely, because I mean, at the same time, you still have to preserve the culture, but you cannot lose lives in the process. So I'm happy to see that this will be happening. And will this be fast-tracked, that they have to be registered, that this has to be now done, and that by next year, I mean, I know you talk of 31 lives that are lost, you know, it's a lot of lives to have been lost. By next year, when the initiation period comes along, can we almost be guaranteed that this is going to be the situation?
It has to. I think other provinces are leading by example, Leanne. Limpopo already registers. People must apply to establish an initiation school through the provincial, local government and traditional affairs department, and also through the approval of the traditional leader in that particular area. So, for example, last year, 300 applications were received in Limpopo, 277 were approved, but in the approval, you need to determine the location and also the conditions, what should be in there, so that we are able then to have all the equipments and the instruments that can really help to prevent deaths. So, we are happy about the announcement by the Premier of Eastern Cape, who also announced 2 days ago that they will be registering for the December initiation school from August. All